Okay, good evening, everyone. Those of you joining us from India, good afternoon to those of you joining us from Europe and the UK, and good morning to those of you joining us from the US. And depending if you're from somewhere else, then whatever the appropriate time of the day is, hi, thanks for coming. My name is Kaushik Krishnan. I work at CMIE. My job is to make record level data from the Consumer Pyramids Household Survey available to our users. I'm joined here today by Mahesh Vyas. Mahesh is the MD and CEO of CMIE. Mahesh is also the person that invented CPHS. Mahesh knows the survey better than anybody else. Mahesh is the author of the survey's documentation, and Mahesh takes the lead in ensuring that the survey runs on a day-to-day basis. Mahesh, thanks for joining us today. For those of you...
Sorry, I was muted. I was just saying my pleasure.
Thanks so much for being here, Mahesh. As audience members are coming in, I'll take a couple of minutes to tell you what you can expect from today's event, how this might be different from other events of ours that you might have attended, and how you can participate in today's event as well. Today's event is a little different from our research seminars. Many of you might have attended CPHS research seminars. That's where we have somebody else, not from CMIE, but someone that uses the data from CPHS, present research work that comes out of the data. That kind of event is meant for the researchers to showcase their work, get technical feedback from a discussant as well as the audience, and improve their papers eventually to submit them to journals, etc. We conduct another kind of event. For example, those of you that joined us just a few weeks ago for a talk that Mahesh and I gave on the member roster, that was an event where it was much more technical, was much more about the survey and how we run the survey. We do both of these events every single month. So please feel free to join us for both of these kinds of events. Every month, they're all open to the public. You can always ask questions. The Q&A box is open to all the participants, and we really look forward to questions, to dialogue, and to debate. Today's event is a little different, even from our standard how we do it events. Today's event is meant to be a recap because a lot of new people have found out about us over the last few months. And you may be wondering, what is Consumer Pyramids Household Survey? It's great that you're telling us about the member roster. It's excellent that you're running seminars where other people are presenting their research. But I want to know, in a nutshell, what you do in this survey. So today's talk is for that. We do this once every 4 months, and our plan is to do it just before one of the waves of the survey finishes. If you don't know what a wave of the survey is, that's fine. I'm going to explain it in just a couple of slides. Please stick around for the entire talk, especially if you're new to CPHS. There's a lot that you can learn. Please feel free to ask questions. As I mentioned, the Q&A box is open. Questions, as you ask them, will be answered almost instantaneously by Mahesh. We still reserve 30 minutes at the end of the presentation to go over any questions that haven't yet been answered or where maybe a little bit more discussion is required. So with that introduction, I welcome all of you to this event. We're really delighted to introduce Consumer Pyramids Household Survey to you. And I'm now going to kick this event off. Okay. So I'm going to start this event a little differently than the way we've started these in the past. And I'd like to draw your attention to when it was that the raw data from CPHS became available to researchers. That was in 2017. And I want to talk a little bit about the research output that has happened using CPHS, not by CMIE. We write very often about the unemployment rate, about sentiments, about a variety of things coming out of aggregates that are computed using CPHS. But I want to focus not on that at all, but on research output in terms of working papers, published papers in journals, etc., that other people have written using the data. As I mentioned, 2017 is when we started allowing access to the raw record level data from the survey. In that first year itself, there was one paper that was written. In 2018, there were 3 more papers that were written, so a total of 4 papers. By 2019, there were 7 new papers written in that year. Many of you found out about us probably in 2020, because in that year alone, 16 new papers were written, which is more than in the 3 years before that. And then finally, even though 2021 isn't done and we have over 3 months of 2021 left, uh, in fact, more than 4 months of 2021 left, in 2021 alone, 21 papers have already been written using CPHS data. And so by our count, 48 papers have been written since the time that CPHS data was made available using the data coming out of CPHS. Now, these are only the papers that we know about, and we try as much as we can to know when somebody writes a research paper. It's great to know that somebody has worked using CPHS. There might be a couple of papers here and there that we don't know about. If you are interested in knowing what these papers are, what they're about, where you can read more about these papers, we try to maintain as up to date a list of all the papers using CPHS on our website. So if you go to consumerpyramidsdx.cmi.com and you click on research, you'll get a list of all of the papers that we've been able to find that make use of CPHS. If you're interested now just in knowing a little bit about what kinds of papers, who are the authors, etc., here's a slide that tries to take you through it. It's a very heavy slide. I don't expect you to spend a lot of time on this slide. I certainly won't. But as you can see, there's been a bunch of papers on a variety of themes: papers on public finance, papers on health, on labor, on social protection, on political economy, on household consumption, on household finance, even on macro. And as you can see, there's a bit of a shift almost in the areas of interest. In the early years, there were very few papers in very concentrated areas. This year, I think we've had at least one paper in each of these areas, if not more. As I mentioned again, if you'd like to know more about these papers, we maintain a list on our website. Please feel free to go to our website and you can see everything that you probably want to know about these papers there. So, I present that to all of you as motivation to talk about what CPHS is. What is it about CPHS? And fundamentally, what is CPHS that has enabled so many people to write papers on a variety of topics? And the answer is that CPHS, very simply today, is India's largest regular household survey. So there's another number that you can see on your screen now. Today, the sample size of households that participate in the survey is over 178,000 households. Those of you that have attended our events before, even our events as early as last month, will know that this number has changed. And that's because we're in the middle of a sample expansion exercise. And today, we have over 178,000 households that participate in CPHS. But more than than CPHS being India's largest regular household survey, we're also the world's largest regular household panel survey. A panel survey or a longitudinal survey, most of you will be familiar with that terminology, is just a survey where you interview the same survey units over time. In this case, the survey unit is a household, which means that every round of the survey, each time we run the survey, we interview the same set of households. As a panel survey, this is the world's largest household panel survey. So not only do we interview 178,000 plus households every round of the survey, we make sure that they're the same households. We never drop households unless a household doesn't respond for a prolonged period of time, about a year. And we're always adding households. We've now run this survey, CPHS, for 22 waves already. And the data from these 22 waves is already available to the users of our data. Let me explain to you a little bit how this number 22 waves comes about. We started the survey in 2014. So even before we released the microdata was only released in 2017. But the survey started on the 1st of January in 2014. And we do 3 rounds of the survey every single year, which means that households in our panel are visited 3 times every single year. The first round begins in January and goes on for 4 months. The second round begins immediately after the first round ends and starts in May, goes on for another 4 months. And then the third round picks off exactly where the second round ends, starts on the 1st of September, and goes on for another 4 months. This cadence is maintained every single year. And we've now done this for 7 years in a row, 2015, 16, 17, 18, 19, 20. And that means that we've already completed 21 waves. In 2021, we've already completed the first wave. So that's 22 waves done. And we're right now in the 23rd wave, which will complete on the end of this month. And then we'll start the 24th wave, which will be the last round of this year. What's remarkable about CPHS is we've not missed a single year in the field. In fact, we've not missed a single wave in the field. We've done every single wave on time, like clockwork, exactly when it was expected. We've not missed a single month in the field. In fact, we've not missed a single week in the field. We've not even missed a single day in the field. The way CPHS operates, we have to keep up survey operations every single day. That's the only way you can survey 178,000 households within 4 months. Every day, whether it's a holiday, whether it's a religious holiday, whether it's a weekend, a public holiday, a state holiday, a national holiday, whether it's harvest season, whether it's a drought, whether it's a flood, whether it's a pandemic, CPHS is running. And we are serving more than 1,000 households across the country every single day, which means more than 10,000 households every single week, which is more than 40,000 households every single month. And that cadence of CPHS is maintained every day, every week, every month, which is how we're able to accomplish this feat. Now, it's great that we've been able to run the survey successfully for 22 waves, and we've got a well-oiled machinery for doing that. And it's also great that we have 178,000 households spread across the country. But for many of you as researchers, you want to know exactly how these 178,000 households are selected and whether you can use the data coming out of these 178,000 households to study India and make statements about India. So let's focus a little bit on how these households are selected. Again, almost everyone that's here today knows that India is divided into states. And everyone that's here today also probably knows that these states are divided into districts. According to the 2011 census, which is the most recent census for which information is available, there were 640 districts in India. We at CMI do something very similar to, for example, what those of you that have used NSS data are already familiar with, which is we aggregate districts up into regions. We call our regions homogeneous regions, and there are 110 homogeneous regions spread across India. 640 districts become 110 regions. On average, about 5 districts turn into one homogeneous region. You might ask, how are these homogeneous regions selected? It's very simple. Homogeneous regions are just sets of neighboring districts that share similar agroclimatic conditions. That's the single most important criterion. They also share urbanization levels, female literacy levels, and household sizes. I'm showing you here, just as an example, the state of Punjab broken up into its homogeneous regions. As you can see, there's a central region, there's a northern region, and there's a western zone. And these, for those of you that study Punjab and know the agroclimatic regions of Punjab, map on quite well to the agroclimatic regions of Punjab. Punjab has 5 agroclimatic regions. We've turned them into 3, but the overlap is precise. And we follow